those ones are the ones who produce the health products and technologies. That is including pharmaceutical companies, any digital company, medical equipment company, ICT company that develops digital healthcare solutions. You'll also have, in terms of private sector, those ones that possibly finance the health sector. So still, whether it is in certain departments within the banks that could be considered private sector, that's stimulate the health sector. Another big health sector is development. Private sector is development partners. Sometimes they act within the nexus. There are those who are completely private sector, those ones who are venture capitalists, the ones who invest in the private sector for a return, but you also have now development partners who invest in the health sector for social good. So those are among the ones I think I can speak about.
Thank you. Going to Dr. Cohen. You know, you're working with the young doctors. The question is, do you think young doctors or young health professionals are well, or have they positioned themselves well in the field to be part of this system? Or are we just there crying, waiting to be given?
Okay, I think maybe I'm going to be honest, I'll be blunt, and also I'll give, there's also the other side. So, maybe you see, like especially for doctors, pharmacists, dentists, you see those that before initially people would be absorbed immediately, yeah? So, you know, nowadays the way the situation is after you're done with the internship, you're on your own. So of course, to be honest, there are guys out there, and I think, again, I'll refer to what Dr. Liz mentioned there. There are people out there who think maybe the world owes them, and they're there, you know, just crying, waiting for the opportunity to come, saying, I'm a doctor. You're offered maybe a certain amount of money just to start, and then you're like, no, because you are being paid this amount during internship. You don't want to go. So that's you don't want to go maybe lower than that. So that's a problem. But on the other hand, there are young professionals that are very aggressive. Immediately someone starts earning money during internship, they're already maybe even doing their MBA, they're doing, you know, other short courses that will make them stand out. I've seen, like, there's a close friend of mine who's a dentist. He's only 27, but he already has his own practice, you know, just by going outside there. And I think there's a concept it usually tells me about, the concept of, it's called OPM. You know, the mistake we make is that thinking that if you need probably 8 million, you need to have all that money by your own. But again, you see there are venture capitalists out there, you know, the concept of using other people's money to start on your own. So I would say that there's both sides of the coin. There are guys who are out there probably thinking the world owes them, but there are people who are out there also very aggressive, learning, taking advantage of opportunities, networking, you know, involved in associations like KMA, PSK, out, and they're prepared. I would say that, you know, they've positioned themselves, and as they say, you know, fortune favors the brave. So there's both sides to it, to be honest.
Thank you. And I think just to echo that, the speaker was here said one of the most important things you have is your skill. One thing I've learned is don't let lack of money limit what you can do. As they have talked about, we have a lot of financial partners, as said here, who are willing to finance. But the question is, are you able to pitch your idea very well? And maybe as a health finance expert, I'm sure if you need an advice in that area, you can reach out to her how to get people finance your project, and she will very well guide you. I heard Dr. Liz talk about data as whole system in terms of health systems, and maybe she can tell us about I'm just wondering, to what extent has the health data been used, and what opportunities does it give give us as young people? Is it a field we can go in, and what are the available opportunities?
In terms of our biggest, I would start from the challenge. Our biggest challenge in the Kenyan setup, even when it comes to health policy development and even implementing some of those policies, is the absence of enough data. As it is currently, even when you look at the Kenyan health data, majority of which is what is gotten during the Kenya Demographic and Health Survey, you have what is taken during the census, and now you have which is taken on a day-to-day basis from the Kenya Health Information System, KHIS. And KHIS has so many deficiencies in terms of majority of the data comes from the public sector. Private sector rarely reports into the KHIS, so you have half the data, and even that half data, since it's recorded sometimes on papers before being translated into the computer system, there's a lot of missing data. So even today, if you were to ask me, for instance, the maternal mortality rate, how is it calculated? Possibly that one is a bit more accurate because they are a lot more focused on doing the, what you call the MPDSR, where they look at maternal death. But we have a lot of, for instance, how much money should we put in diabetes? We don't know, we have no idea how many diabetics we have in this country. Yet they come to our health facilities, but there's no probable opportunity to collect that data. So in terms of young professionals, I think there's an opportunity in terms of participating in the data science of it, in terms of getting more skills in terms of analytics, in health data science, so that you're prepared during the rollout of the Digital Health Act, which is being rolled out, because the essence is to be able to get everybody on one platform so that more data is collected. So for sure we are going to need a lot more health data scientists going forward, and it will be better if you have a bit of health background as opposed to us getting people from bio and math for them to come and do this for us. Thank you.
Thank you. Dr. Cohen, you know you're passionate about advocacy as a policy. And the question is, to what extent are the youth on the discussion table? She was talking about youth and women and people with disability being grouped together. Most of the time they take someone with disability or a woman, then they leave out the youth. So the question is, with your own analysis, to what extent are the youth on the discussion table, and what can we do? Especially now this is a youth entity, and this will be very key to us as a group. How do we mobilize the youth to be at the discussion table, and how do we ensure that we are heard?
I would say maybe, sometimes the biggest mistake we make is that we wait for someone to come, and call us. And no one is going to, there's this book, 7 Habits of Highly Successful People. So the first habit is usually being proactive. So the mistake we make is that we're just sitting out there and not come. No one will ever bring you. You're not supposed to take the initiative and go out there. So you see, like, even in terms of policy, whether in terms of laws, let me give an example of, let's say, a situation like right now, I know you might have had that conversation in one or another, but like right now the way the pharmacy profession is, it's governed by KAPH 244. But there's a member of parliament who took a motion of a bill in parliament to change KAPH 244 to a different, the Kenya Drug Authority, there's that process in parliament. So I remember talking to Dr. Libe about it. We weren't involved, but you see, our seniors in the profession were the ones who were driving it and everything. But we took ourselves and said, we want to get involved, how can we help? And from then on, we were brought on board, and even you see that, lobbying, even going to parliament, following all those proceedings and everything. And sometimes even giving our own input, because you might think the way, again, Dr. Liz alluded to it, because Dr. Liba is a year or two older than me, so in all those situations, in all those scenarios, I'm the one who used to be the youngest. And you can enter the room and maybe think, I'm the youngest here. Someone, I remember there's an MP who were meeting. The first time I was elected, I wasn't even born. So you might subconsciously you might even start telling yourself maybe you don't fit here and all that, but it's just about putting yourself in that space, and you learn as things unfold. I wasn't conversant with that process, how it's made and everything, but in a period of just about 3 months, I mean, I consider myself an expert, quote unquote, in that. So I think it's just about, for young people, it's just about putting yourself out there, and you'll be surprised at how it's like, sometimes when you ask for an opportunity, I will go probably to Dr. Liz, and then she'll be like, by the way, it's like, I was looking for someone. So it's just about showing up, and those opportunities will be there, and being actively involved, because no one is going to wake you up out of your bed to get involved. So for young people, I guess it's just about putting yourself out there, join associations, and you'll be mentored. To be honest, I usually look at young guys saying that, or sometimes even out of frustration, pointing fingers to people who are ahead of you. But from my experience, the older generation, they are very much willing to get young people involved, mentor them, and also just to pass the baton very seamlessly.
In terms of, I think we've mentioned a lot of putting yourself out there. Maybe you're seated there and you're saying, me, I can never talk in front of people. There are other opportunities for you. Maybe you like writing, yeah? So volunteer and give that which you have. See, the Bible also says you give that which you have. So if you're not a person who wants to come and participate in policy and lobbying, maybe you write very good articles. KMA has a newsletter, PSK has a newsletter, I'm sure he has a newsletter. Write articles. You will write articles until at some point, maybe one day somebody will come and say, maybe we need to give this article to people daily, and that is how you become an health opinion creator. So do not feel disadvantaged because possibly your personality is what you don't think you like speaking in front of people. There are many other skills you can give in every sector that there is. So for instance, if it's talking about the health bill, in KMA we have a lot of people who you might never see them, but they write a lot of which comes out. So there are the people who are the brains behind what is actually spoken out, and that can be your role, and it's pretty significant because you're still contributing to the growth of whatever organization you're in.
Thank you so much. I think that that is all that I had, so I'll welcome all of us to ask questions. So you can, yes.
Good afternoon, everybody.
Good afternoon.
My name is Edwin Khalil. My question is to Dr. Liz. You say that you're passionate about health financing. So my question is, why have we always gotten it wrong for the last many years? And what can we as young people do to make it work? Because we have people in the villages, once they get a terminal illness, that's, it takes them back. We have, health financing is the reason why there's limited health access in counties like Kilifi, Mandera, and all those places. So what can we do it right? How can we do it?
So I think it's not a simple answer, I would say, in terms of there's not a one size fits all. But in terms of health financing, comes a lot from one, lack of resources, and two, I would say, I wouldn't call it lack of political commitment, but maybe low political commitment and lack of prioritization of the resources that we have. For instance, I'd say maybe our budgetary allocation to health has remained lower than possibly what is possible for us to deliver healthcare. And also in terms of our policies, sometimes our policies in terms of what constitutes health service delivery might not be efficient in terms of ensuring that the resources that are gotten within the health facilities go back to the health facility to ensure that they are utilized only for health service delivery. And in essence, when it comes, like for our setup in terms of social health insurance, you have a lot of what we call adverse selection in terms of those people who are sick are the ones who want to pay for NHIF, and the reliance on employees who only constitute about 3 million Kenyans who are sort of employed in a way that allows them to give money to NHIF. So I would say in terms of our policies have not been very proactive towards that direction, and possibly we have an opportunity right now with the new laws that are put in place in terms of getting the social health insurance in place for us to better finance health, where you have tax-funded initiatives and also you have contributory initiatives. So essentially, we have more tax going into the health system. We are able to purchase more health, because basically it's all about purchasing health. We're able to purchase more health for the people, and then in terms of getting everybody contributing what they're able to contribute, for us to have more resources. I think all we want is more resources, and once you have more resources, allocating them more efficiently. So what can you as a young person do? Currently, we have an NHIF. Ensure everybody around you has enrolled on NHIF, so that you're not contributing to their needs. If your mother, your auntie, your grandmother has not registered on NHIF, ensure they have registered, because if they're registered and today they get a diagnosis, they're more likely to get care than if they did not have NHIF. And then when you go into the SHI, ensure you've read, because you're the health professional, so that when people ask you questions in the village, you're able to give the answers to how this is going to work, and so that you even get buy-in for some of these initiatives. You can even write opinion pieces to your fellow youths who are not in the health sector in terms of what is your opinion, the good, the bad of the social health insurance, or even the good or the bad of NHIF, and how they can ensure that they participate in this health financing process.
My name is Silvanus Manyala. Just in the same spirit, my question was a bit related. To the best of your knowledge, are there specific policy changes or investments that are needed to create a conducive environment for the development of young healthcare professionals? Would you be aware of such? And then to Cohen, we talked a lot about putting ourselves out there. So I just want to understand how can we ensure the diversity and inclusivity in opportunities, and of course support for young healthcare professionals within the health systems. The how. I know one of it is throwing ourselves, but in policies and in healthcare systems, how can we ensure the diversity and inclusivity of young healthcare professionals? And then to both of you, what are some of the ways that public-private partnerships can contribute to the development of the resilience of healthcare systems, in particular in the context of young healthcare professionals?
Thank you. In terms of policies needed, yes, there are many policies needed, including training policy. And you come to training policy is also having sort of like a gap analysis or a skills analysis of what is needed in the current setup. Do we still need to train the same kind of health professionals we've been training over the years? Do we still need to train more CEOs? Do we need to train more nurses? And which kind of nurses do we want to train? Which kind of doctors do we want to train? Are there other health-related courses that you might want to focus on, and in what numbers? So does it make sense maybe to invest more in ensuring that we upscale the current medical officers as opposed to increasing that training to 1,000 people who might not get jobs? Or does it make sense to now ensure that we upskill them through ensuring that we stimulate the residency programs that are there? And possibly I'm giving examples from a medical doctor's perspective because that's where I come from, but what I'm saying can be also can be generalized to also other people. And when it comes to policies, also in terms of who makes decision as to what we are training. Remember, currently the Ministry of Higher Education is the one which is in charge of higher education, but are we involving the regulators? Are we involving the industry, both in public and private sector, to determine what the market needs, so that we are not training people who the market doesn't need, or maybe yes they need, but they do not come with the current, I would say, software or skill of what the market needs. And for instance, I had spoken about data science. We are training data scientists, right? But if we are going to need people with health and a bit of data science, do you want to merge them the same way people merge BBIT, business and IT? Do you want to say we want to train people in health IT so that you have a bit of background in understanding how the health sector works, but also have a IT so that you go directly into that space. So yes, there's a lot in terms of training, in terms of young professionals. And in terms of public-private partnership, it's a huge thing, I would say. Yes, there is need. The simple answer is yes, there is need. And because of the efficiencies of both sides, because the government, of course, has the people, the government has the buying, the government has the data, the government basically owns everything, but the private sector comes with a bit of efficiency, they can come with a bit of money, they can come with a bit of the knowledge, and also their own partners from aside for them to be able to utilize this data. There's a lot going on in the country about public-private partnerships and collaborations. I work with Dr. Frank also in a project or an innovation hub where we are trying to also stimulate public-private collaborations so that the public and the private sector don't act parallelly, but they work together to ensure health services delivered.
Right. Okay, the first question was about how getting involved, yeah? So I would say maybe how you can get involved. You find that like most of the people who drive policy advocacy, you find that like in the case of MOs, medical doctors, we have KMA, and I would say one of the ways you can get involved is by, let's say, joining these associations, because when you join KMA or when you join PSK, and I'm sure maybe if there's a bill or there's an amendment or there's any proposals in terms of policy that is, whether it's in parliament or from cabinet that is discussed, these institutions usually discuss it and they have committees that deal with that. And like KMA, for example, in the case of KMA with the Young Doctors Network, I know for YPG we've borrowed a lot and learned a lot even in terms of setting up our structures from that. So when you're a young professional, you join, and these associations already have that, pathway of young professionals getting involved. I think Dr. Liz, you were the first KMA YDN convener. Yeah. So we learned a lot from that. So when you join maybe these associations, that's a pathway. And by being involved, it gives you, let me say, a free avenue of, let's say, getting mentors, because maybe there's someone who's senior in the professional that you look up to. It's very easy to meet them during conferences, AGMs, and you can always, it's easy to reach out to them directly when you're in that environment. On the part of PPPs, public-private partnerships in strengthening health systems, I'll give a personal example, or like an example from the pharmacy field. JPEGO it's a private institution, yeah? And I remember there's that talk of when you speak of, like, let's say, strengthening health systems, from a pharmaceutical point of view, HPTs, there's need to access medicines, and there's need to access maybe, for you to access medicines, you need to have a supply chain system that works very well, that ensures that the right drug is delivered, in the right quantities at the right time to ensure that stockouts aren't there. So that requires someone who understands the supply chain system for that to be done. And when you look at the way we have, let's say, to be honest, let's say in training, you learn the pharm chem, you learn the pharmacology, most of the way the training is structured, the clean farm, it's that when you graduate, you're not necessarily equipped. Okay, from internship you'll have a bit of that aspect, but remember JPEGO is a private entity, carrying out workshop together with Pharmacy and Poisons Board, which is a government entity. There was that discussion which was, I think, fully sponsored by JPEGO. So you see, JPEGO brought the money, PPB has the data of how the curriculum is, maybe the flaws that are there. So with that, there was that discussion where maybe moving forward, when pharmacists are in training in undergraduate, how do they strengthen their knowledge of supply chain? And I remember, because Dr. David is part of regulatory affairs pharmacist, but if I ask you, how much did your undergraduate years prepare you for regulatory affairs? Probably you would say, at best, maybe 5%. So, you see, that partnership can come on board. This is a private entity, this is a public entity. So they're coming on board probably in view of having a situation whereby in maybe 10 years the curriculum will be changed so that if someone wants to be a regulatory affairs pharmacist like Dr. David, they are more prepared from the undergraduate level. So I think maybe that's an example I had often of a public-private partnership in strengthening health system.
Thank you so much. I think with the interest of time, we will not take more questions. And we have another session. We're starting this on there in the afternoon session when we are having discussions. So thank you very much, the panelists, and let us appreciate them. Asanteni sana kwa kutusikiza, and hope to see you in the afternoon.